Hello, I'm Dr. Michael Chen. I'd like to talk a little bit about an actual endovascular brain aneurysm treatment procedure. So as opposed to years ago, nowadays we no longer have to as commonly perform a craniotomy, which means an incision in the skull to gain access to the aneurysm. We're able to work from inside the blood vessels using a very small incision, either in the wrist or in the crease in the groin, to gain access using spaces that already exist within your arteries to gain access to the aneurysm. And by using catheters, x-ray, contrast, we're able to hopefully seal off that aneurysm to reduce the risk of future bleeding. Most of the time for these procedures, they're scheduled ahead of time. We have to get some pre-op blood work and some testing. And then on the day of the procedure, nothing to eat from the night before. And you'll meet the anesthesiologist in the pre-op holding area. We'll discuss the procedure once more. The anticipation of the procedure is usually the most difficult part, honestly. But once we get started, most of the time we'll have you asleep for the procedure, which means general anesthesia. And then once that occurs, we're able to gain access most of the time through the incision in the wrist and the radial artery right over here, or through the crease in the groin through a small incision. And from there, we're able to gently advance the catheters under x-ray guidance up to the arteries in the neck. And from there, using contrast, we're able to obtain high-resolution images of the arteries in the brain. At times, we're also able to obtain a three-dimensional reconstruction image of your artery, which allows us to look at it from any direction and really best understand its relationship to other normal arteries and other technical features that help us choose the best technical approach. From there, we have a variety of different options available, whether it's coils alone, which are made of platinum, or a braided device that we place inside the aneurysm dome, or even things like stents or other things called flow diverters. These are all devices that have their unique properties and are better in certain situations. And the goal is for us to choose the approach that would give us the best chance of having a very effective and safe outcome. We're very experienced with these devices. In fact, we do get asked to work with other doctors at other hospitals to get them sort of familiar with how to use these devices in a variety of situations. Nevertheless, the procedure itself usually takes about an hour or so. Obviously, we take as long as we need to take care of things carefully. And then once we're done, we wake you up from the procedure, make sure your incision is healed well, and keep an eye on you in the intensive care unit overnight. Most people are then able to, if things go well, be able to go home around lunchtime the next day. Again, usually the anticipation is the hardest part, but once it's done, most people feel like it wasn't that big of a deal. We talk about what type of post-op follow-up would be appropriate, as well as any type of surveillance imaging that will help us keep track of the durability of our treatment. As you might imagine, this procedure is not without risk. There is usually on average between a 3 to 6% risk of any type of serious complication that can occur during a procedure like this. And that's why we have to be very careful when we do decide to pursue any type of aneurysm treatment. But having said that, I think what really makes a difference in outcomes is getting treated at a place that really specializes, in this type of a disease, as well as takes care of a large volume of patients with a similar disease. I think that ensures that the entire team involved in your care is really familiar with what needs to occur, is able to anticipate the next few steps, and has seen a variety of situations and knows how to handle them. So that, in a nutshell, is an overview of what an endovascular brain aneurysm treatment would involve. Thanks.